Post-operation home care after wisdom tooth extractions. This presentation video will go over what to do, what not to do, what to expect, and the possible complications after wisdom teeth extractions. You may have only one wisdom tooth removed, or even all four, but the post-op instructions are basically the same. Wisdom tooth removal is usually a surgical removal and involves cutting tissue and even bone. Sometimes the procedure also involves sectioning the wisdom tooth to be able to remove it from the limited accessible area. Most likely, there will be sutures placed to help with the healing. These may be resorbable or not resorbable. Your dental surgeon will let you know what kind or if any sutures were placed, and whether you need to return for a post-operative visit to check on your healing and possible suture removal. What to do? To make your recovery as easy and as successful as possible, try to follow as much of the instructions as possible. Do not remove the gauze. The first thing that was done was to place gauze in the area of the tooth extraction. This is to stop the bleeding and create a clot in the socket. Do not remove it. Keep this in the area as long as possible, and at least as long as the freezing is working in the area. Change gauze only as needed. The longer you keep the gauze in the mouth, the better will be the healing. You will be given extra gauze to take home so that you can change the gauze if it becomes too saturated with blood or saliva. It is not necessary to change the gauze if it's not too wet. Make sure the gauze is wet. If you are going to change the gauze, make sure it is slightly wet. This will prevent the gauze from getting stuck to the clot. If the gauze gets stuck to the clot, removing the gauze will tear the clot and the area will start bleeding again. Place the gauze correctly. Make sure the gauze is on the extraction site area and not on the adjacent teeth or space. You need to create pressure on the extraction area to stop the bleeding and create a clot. Do not eat until the freezing is gone. If your lip and/or tongue is still frozen, you will not feel the biting pain, and you are very likely to bite your lip or cheeks or even tongue while eating if you are still frozen. Eat only soft foods. Once the freezing has gone, you can eat. You should, however, only eat food that is soft and does not require a lot of chewing and biting. The movement of the food over the clot area can break the clot and cause the area to bleed again. Do not perform strenuous activity. Heavy exercise or work activity will increase the blood pressure, and this may break the clot and make it bleed again. Try to minimize any strenuous activity at least 2 to 3 days after the extraction. Do not play with the stitches. If stitches are placed, they will keep the gums and surrounding tissues in place for healing purposes. If you keep touching them with your tongue or fingers, they will get loose and not be able to do their job. Your healing will not be as successful. No rinsing or spitting on the first day. Vigorous rinsing and spitting should be avoided the first day after the extraction. The movement may break the clot and cause bleeding. You can start rinsing gently the following day, but if you notice more bleeding, then you should stop. Use salt water to rinse. The best liquid to use for rinsing is salt water. Place a tablespoon of salt in an 8-ounce glass, mix it until it's dissolved, and use it to rinse the mouth. This is a natural way to prevent and fight infection. Do not smoke. Smoking will decrease the rate of healing and can cause infections in the area. If you must smoke, try to stay away from smoking for at least 3 days after the extraction. Do not drink alcohol or carbonated drinks. Drinking alcohol will thin the blood and cause more bleeding. Carbonated drinks will also promote bleeding by dissolving the clot. Do not drink with a straw. Drinking through a straw will create pressure in the mouth and may promote breaking of the clot and may cause bleeding again. Try to avoid sneezing. Sneezing will again cause a lot of pressure in the mouth and may break the clot, causing bleeding. If you have a seasonal allergy and know you will be sneezing a lot, take the antihistamine meds to decrease the sneezing. Do not brush the area. You can brush the teeth, but make sure you do not brush the extraction area. Brushing may break the clot and cause bleeding. Possible post-op pain. There could still be considerable pain even after a simple extraction. If you are not prescribed a medication by your doctor and you are experiencing pain, you should use over-the-counter anti-inflammatory medication like Motrin or Tylenol. Prescription medication. If over-the-counter medication does not relieve the pain and you are not given a prescription already, contact our office and we'll prescribe you a stronger medication which you will need to pick up at the pharmacy. Possible swelling and bruising. With wisdom tooth extractions, there is usually quite a bit of swelling and bruising. This bruising can spread to the cheeks and even under the eye and down the neck. It will act like any other trauma. Swell first, then turn bluish-gray, then yellow, then disappear. The worst time is the first 3 days, but may take as long as 10 days before all the swelling goes down and fully recover. Cold packs need rest periods. Placing a cold pack on the area of the extraction will decrease the amount of swelling, but you should remember to not leave the pack there continuously, as this will freeze the tissues. 20 minutes on and 20 minutes off is a general rule. Cold packs work best the first day. You can repeat this as long as possible to decrease the swelling. This is very effective on the first day. After the first day, the cold packs have little effect on decreasing swelling. Homemade cold pack. If you are not given a cold pack or cannot get a cold pack, you can use frozen peas or frozen corn in a sandwich baggie as a substitute cold pack. These homemade cold packs actually work quite well. Post-op bleeding. Sometimes, no matter how careful you are, the clot breaks and there is bleeding from the area. There are many reasons why the area may start bleeding again. If you have gauze left over, place the extra gauze in the spot again as before. Homemade gauze. If you run out of gauze, you can use a slightly moistened tea bag. The tea has tannic acid, which helps contract blood vessels and therefore reduce bleeding in addition to acting like gauze. Tea bag placement. Make sure you place the slightly moistened tea bag in the area of the extraction the same way you would the gauze. Allergic reactions to medications. If you are using medications, you can experience an allergic reaction, even if you have used the medication before and had no reaction before. An allergic reaction is usually an itchy rash. Other allergic reactions. Rash is the most common allergic reaction, but there are other common ones that are important, such as swelling of the face, tongue, throat, dizziness, headaches, and difficulty breathing. Allergic reactions can be serious. Allergic reactions can get worse the more times and duration you are exposed. So if you know you are allergic to something, make sure you try to avoid being exposed to it again. What to do during an allergic reaction. If you get an allergic reaction, like a rash, contact our office right away and stop using any medications until advised by your doctor. If you have difficulty breathing, get to a hospital as quickly as you can. Side effects. An upset stomach, diarrhea, or secondary infections are not allergic reactions. These are side effects. Although not comfortable, the side effects may not be severe and not always a reason to never use the medication again. Other complications. Sometimes the surgical area loses the stitches too soon and opens up, exposing the tissues below. If not too severe, the area usually just closes back up. If it does not close, the surgeon may place additional sutures to help with the healing, and the tissues should then heal normally. Sometimes the area does not heal in an ideal way and creates a depression or concavity. This concavity will collect food and slow down the healing. Ask our office for a saltwater syringe to clean the food debris. How to clean the wisdom tooth extraction site. Fill a plastic syringe with salt water and place it just above the area. Then, with one gentle pushing motion, you can flush out the extraction site with salt water. Repeat if needed. Make sure you do not poke the area with the syringe, as this will disturb the clot or even tear the tissue and cause bleeding. Continuous bleeding. Sometimes the clot just cannot form and the area continues to bleed. If this is the case, keep the gauze in the area with as much pressure as possible and contact our office. If you cannot contact our office, you should go to the hospital as this can be quite serious. Severe pain. A few days after a tooth extraction, a dry socket may occur. This happens when the space created by the tooth removal does not fill in with a clot, leaving the bone and nerves exposed to the mouth. This eventually causes severe pain. Contact our office. A dry socket can be treated to relieve the pain, so do not hesitate to contact our office if you have severe pain or other serious symptoms. We are here to take care of you after your procedure. Talk to our team of experts to find out the best option for you.